Now pediatric nephrology. So a child presented with boil on the leg 2 weeks ago and is now presenting with cola colored urine. Boil on the leg and now it is cola color urine. What is the generally diagnosis? So this is nothing but boil on the leg means some infection, and that is generally caused by streptococcus pneumonia. So streptococcal generally infection is there, the history of infection with streptococcus, plus now the kidney function is damaged, that is cola colored urine is seen there. So this is going towards your post streptococcal glomerulonephritis. Look, there will be generally immune complex deposition in glomerulus and resultant damage leads to dark urine referred to as T or cola colored urine. So this is the case of PSG and post-streptococcal glomerulonephritis. In minimal change disease, the disease is itself telling you that there is minimal change, so there will be generally nephrotic range proteinuria will be present and nothing will be found there. Minimal है तो कुछ ज़्यादा दिखेगा नहीं आपको. IgA nephropathy की अगर मैं बात करूँ तो there will be hematuria after upper respiratory tract infection. Next is nodular glomerulosclerosis and then it will be seen in diabetic nephropathy. A child presented with palpable rash on limbs, hematuria, joint pain. There was history of respiratory infection 1 week ago. History of respiratory infection, palpable rash on limbs. Now hematuria also and joint pain also. What is the probable diagnosis? So this is going towards your inox-snollen purpura. HSP की तरफ जा रहा है. HSP की तरफ जा रहा है, that is inflammation of small blood vessels will be there and thus the blood vessels in skin, kidney, joints start generally leaking and that's why there will be palpable rashes present everywhere. So main buzzword here is the palpable rashes. So this is going towards your inox-snollen purpura. If it is a case of rheumatoid arthritis then you will see PIP, MCP and bilateral wrist joint involvement जो कि यहाँ पे क्वेश्चन में नहीं दिया गया है. They are generally giving you joint pain का generally एक overall history दिया हुआ है. Hemolytic uremic syndrome में there will be the history suggesting renal failure and in generally reactive arthritis, urethritis, conjunctivitis, uveitis and arthritis will be present. So that is generally the triad of reactive arthritis. Let's move ahead and see the next question, that is a 6-year-old child weighing 12 kg has a urinary output of 0.4 ml per kg per hour in the last 12 hours. To which stage of KDIGO staging of acute kidney injury does the child belong to? So this child belongs to generally the second. How? Look, I'll tell you. KDIGO generally acute kidney injury में generally the stage. So acute kidney stage 1, acute kidney injury stage 1, that is creatinine criteria will be 1.5 to 2 times the baseline. So normal से that is 1.3 जो normal range लेते हैं, 1.4 is the upper limit, ठीक है, 1.3 is the normal range, उससे generally 1.5 to 2 times more and urine output is less than 0.5 ml per kg per hour for generally greater than 6 hours. 0.3 mg per dl increase from the baseline or greater than 26.4 millimole per liter. AKI stage 2 में generally क्या कर सकते हैं हम? AKI stage 2 to 3 times the baseline, 2 to 3 times the baseline, that is, and यूरिन आउटपुट की अगर मैं बात करूं सो देयर विल बी जनरली लेस देन 0.5 ml kg per hour for greater than 12 hours. If I talk about the AKI stage 3, that is nothing but 3 times the baseline and 0.5 mg per deciliter, 44 ml, वो सब आप देख लो एक बार, है ना. Any renal replacement of therapy is given there and urea for greater than generally 12 hours. So this falls in our grade 2. This falls in generally urine output कितना दिया हुआ है? Urinary output of 0.4 ml per kg per hour in the last 12 hours. 0.4 less than 0.4 per kg per hour for greater than 12 hours. ऊपर वाला कितना है? 6 hours. So this falls in generally second stage. पोस्ट स्ट्रेप्टोकोकल ग्लोमेरुलोनेफ्राइटिस इन चिल्ड्रन इज डायग्नोज्ड बाय, कैसे? पीएसजीएन को डायग्नोज कैसे करेंगे? सो देयर विल बी माइल्ड प्रोटीनूरिया, हाई हेमेटूरिया एंड हाई एएसओ टाइटर विल बी देयर. लुक, glomerulonephritis is characterized by generally inflammation of glomerulus leading to hematuria with subnephrotic proteinuria. The inflammation follows a skin infection or a generally sore throat and therefore requires generally serological evidence in form of elevated ASO titer of anti-DNase B. Look, I told you na, skin infection जो boils आगे दिया हुआ था in the previous question, there was mentioned boils were present on the skin, so skin infection also consists of generally this PSG only. A male infant was brought to the emergency pediatric unit with abdominal distension. There was a history of recurrent urinary tract infections. On examination, he was found to have urinary retention. Imaging showed generally bilateral hydronephrosis. What is the diagnosis? So if there is given bilateral hydronephrosis, so ऊपर के सारे symptoms plus this bilateral hydronephrosis, this generally it is showing that if bilateral hydronephrosis है means there is some जो रिफ्लक्स है वो हो रहा है, एंड वो रिफ्लक्स की वजह से क्या हो रहा है कि यूरिन नीचे नहीं ऊपर ही जा रहा है, एंड दैट्स व्हाई देयर इज के बायलेटरल हाइड्रोनेफ्रोसिस इज बीइंग सीन. ठीक है, बायलेटरल हाइड्रोनेफ्रोसिस इज सीन एंड इट इज शोइंग दैट एटियोलॉजी इज प्रेजेंट जनरली बिलो द यूरिनरी ब्लैडर. ठीक है, यूरिनरी ब्लैडर से नीचे जनरली क्या है, एटियोलॉजी इज प्रेजेंट बिलो द जनरली यूरिनरी ब्लैडर. सो हेयर रीनल कैल्कुलाई नहीं, यूनिलैटरल और नो यूरिनरी रिटेंशन होगा इसमें. रीनल कैल्कुलाई में कभी भी जनरली क्या होता है, यूरिनरी रिटेंशन नहीं होता है, एंड इट कैन बी सीन जनरली मोस्ट ऑफ द टाइम इट इज यूनिलैटरल. नेक्स्ट लुक, पीयूजे ऑब्स्ट्रक्शन अगर रहता है ना, पीयूजे ऑब्स्ट्रक्शन में देयर बी यूनिलैटरल एंड नो यूरिनरी रिटेंशन. पोस्टीरियर यूरेथ्रल वाल्व, यस दिस कैन बी द कॉज. ठीक है, मैंने आपको बोला था यूरिनरी ब्लैडर के या तो यूरिनरी ब्लैडर और आफ्टर द यूरिनरी ब्लैडर द प्रॉब्लम कैन बी देयर ड्यू टू व्हिच द हाइड्रोनेफ्रोसिस इज अकरिंग. यूरेथ्रल स्ट्रक्चर की मैं बात करूँ तो नॉट कॉमन इन इन्फेंट एंड वुड कॉज अ ट्रैबिक्यूलेटेड ब्लैडर बट नॉट द VUR. आगे देखो, म्यूटेशन इन NPHS1 जीन कॉजेज व्हिच डिजीज. NPHS1 जीन, द म्यूटेशन इन NPHS1 जीन causes which disease? That is nothing but congenital Finnish type nephrotic syndrome. This is a generally a rare form of nephrotic syndrome, occurs in families of Finnish origin and manifests shortly after the birth. This is generally caused due to the defect in nephrin protein found in the kidney, and gene responsible is NPHS1 gene. So this is generally congenital Finnish type nephrotic syndrome. In the next topic, we'll talk about the respiratory system. So this much for this video. I'll try to meet you in the next video. Thank you so much.